5, 4, 3, 2.
Health is wealth. This truism remains fundamental in the life of individuals, community, or a nation, as only healthy persons can contribute meaningfully to their immediate families, the society, and the world at large. Research has shown that, despite efforts by successive governments, there is a huge gap in meeting the universal health coverage in Nigeria, with the burden of health care delivery mostly on the government. This is why several efforts and commitment through programs meant to close existing gap have been introduced over the years, with primary health care as the bedrock of health service delivery.
You have to appreciate the fact that the FCT is a highly cosmopolitan, and the human dynamics or the human population dynamics is extremely high in this particular area. You have a situation where the population in the FCT is increasing 3-4 folds within a span of 5 to 6 years.
Like other government health intervention programs, pursuant to an improved health care system, the Saving 1 Million Lives program was vetted in October 2012 by the Federal Ministry of Health. Machinery was immediately activated.
Saving 1 Million Lives program started in 2012 as an initiative of the Federal Ministry of Health. It was a response to high mortality rate, especially of women and children back then, which was only second to India. And when they realized that they needed to come up with an initiative that will help to improve the health indicators in the country. So they did a pilot in 13 states, which was funded by Gates Foundation. And at the end of 2015, when the results came out of the pilot, they saw that it really improved the indices so far.
The introduction of the Saving 1 Million Lives initiative, particularly in the FCT, to a large extent brought about health improvements within a short period of time, and the determination of the FCT to succeed with the program from onset explains the progress made so far, as evident in FCT winning several awards and recognition on its implementation of the health initiative.
They decided to adopt this model of results-based, performance-based results. When they give you money, you do intervention in certain areas of maternal and child health, and then they come and assess you based on the baseline, and they now reward you based on your scores.
In 2016, the Saving 1 Million Lives intervention was branded as SOML Program for Results. SOML, as a broad-based investment program, has 6 distinct health pillars: immunization, malaria control, nutrition, prevention of mother-to-child transmission of HIV, delivery of essential medicines to address common childhood illnesses, and strengthening of maternal and child health delivery platforms. This has today brought testimonies of healthcare delivery, especially to the common people.
Wabasu ga yini do ga su kakalaka ali ba kalanta ye pasiga tabaku ga ibaya baga kinga fala ga kimi mandala ye ha ngaloge ga ki kuma wabasinu amo wabe tinya dim wabe ya seriama baga fala ga ki mandala ha ga ki wo aji beji ngade wo pari ji kuma baga temiki toto ye aga pupu aga ga ba gi ngalo tunuana ga pu ka fala ga go ga fala ga nyaki fe wa nyaki ga da ba nya go madu sayo aza ba mamusia ye ma go de ki shachi nya ba ga tinyi se ba ce se ga ti ba
daidai bakin gwargwado muna samun agaji daga organization daban-daban idan har muka zo asibiti, kuma ana zuwa har unguwanni wani lokaci a kawo mana taimako wanda ya kunshi kamar su magunguna, magani kamar na cizon sauro da kuma kamar na tsutsan ciki haka na yara. Sannan kuma akwai wani yana na wasu 'yan kwaya-kwaya haka ja ana samu mu abin nan mai ya gashi mu ba yara. So a gaskiya muna samun wa'annan agaji din.
Obi da anyị aṅụrị, anyị nwa na-abịa ebe a mụ nwa. Mgbe kere anyị net, eso m na ndị benefit na net. O nyere anyị aka ọfụma iji dị n'ala n'ụlọ, even mgbe anyị mụrụ nwa. Maka mosquito anwụnta o gbochiri anyị anwụnta ọfụma o meghọ ka anwụnta metụta ụmụaka anyị ma ọnwa anyị kụ n'aka mgbe anyị mụrụ nwa.
Beyond the expression of words, the question of health delivery deficit is beginning to be addressed with the Saving 1 Million Lives program in the FCT, with health safety nets capturing larger and wider percentage of the populace in the 6 area councils and communities' primary health care facilities. The FCT administration's seriousness with SOML recorded successes evident in FCT becoming 3rd and 4th positions in the National Champion National Survey of States that are making progress in terms of fund utilization and getting results. And FCT has always been first in the North Central for the Zonal Champion category survey for several years. These great feats have earned the Honorable Minister of FCT, Mohammed Musa Bello, awards of excellence and recognition for the administration's unflinching support for the SOML PforR. Worthy of note in the FCT SOML success story is the human and capital resources coordination defined by periodic meetings and teamwork from diligent and hardworking professionals who are always conscious of the need to get results by making the difference.
We work closely with our teams in FCT and make sure that we are on the right track. So during these performance management meetings, we make sure that each pillar presents and tell us where they are, what they are doing, and then with the help of the team, because FCT is really blessed with high caliber professionals that are all in this team, and they contribute, even with the help of the partners, development partners and the team. They also contribute to making sure that we come up with quality decisions which will move the FCT forward in terms of achievement.
From the Abuja Municipal Area Council in the Federal Capital City to faraway Kwali and Abaji councils, the story of SOML evident intervention is the same. Likewise, Kuje, Buari and Gwagwalada councils, the benefits have brought healthcare solutions to the generality of the people.
maternal and child health, they've been so supportive. Let me talk about the recent one that they even gave us scanning machine for our mothers, the antenatal women. That was just the latest and the least they've been doing over the time. They also gave us drugs for antenatal and even the DRF across board.
Before Save 1 Million Life, you can imagine having some facilities with few staffs and no equipment. Save 1 Million Life have been able to come in such areas. They equip some of our facilities, added to what we can really achieve. Because without equipment, you can't do anything.
A dúpẹ́ lọ́wọ́ àwọn SOML torí pé ìgbà tán fi wá wọ́n fún wa ní net, ìgbà tán kó net wá wọ́n fún wa, ìgbà vitamin A náà wọ́n fún wa, ìgbà tí wọ́n gbà àwọn oúnjẹ wa tó máa benefit àwọn ọmọ wa wọ́n fún wa náà. A dúpẹ́ lọ́wọ́ wọn, olóòtúbọ̀ jẹ́ kọ́wọ́ wọn mọ̀ lókè o.
Eduwa dalamin da ya taimako ji sosai don ne irin rigar sauro abubuwa jinan da har irin motte kongo ya kata me modde bikon ami.
I want to thank them. If not because of them, I don't know, my second son have been sick, but because of the immunization that they bring and they give my pikin is now healthy.
A lokacin da mi biyan wannan mi biya antenatal na mi biya na a ce gaye atla net biye na la net biye na a ga yayi na ga yayi na ga da jan fine biye amma kafin ya jan fine biye na ilun pe igido for 24 hours ilun la pe igido 24 hours biye zo ci abiye jan fine biye bo malaria na ji damuwa na
umoni mai sije o wa me ira me bo na de me vo activity na ni me vedo de bu coming that kimani na me testing me na me test de kimeje so image that sure that same mosquito net me mosquito net na da ke oni vene ko alone mi me lo poro di mi mozi so poro to ya ni self mi akwa ilo ina ni ya esun so mama kumori haba ki me lo mere manyo malaria in pregnancy.
The painstaking supervision and coordination in the FCT SOML PforR has kept all stakeholders' eyes on the goals of delivery with high performance index. This must also not go unnoticed. Routine immunization, as one of the pillars of this program, has recorded great success with a template in the FCT that is consistent, improving immunization indicators. FCT made significant progress in 2018 from 63.4 points in 2016 to 80.5 points in 2018, supporting FCT Primary Healthcare Board in these regards. The FCT SOML PforR under immunization speaks volume considering these interventions as highlighted.
During the immunization program, they intervene in providing logistics and payment of stipends to those participants that took place in the program, because sometimes there were occasions UNICEF or WHO was not available to pay, and they had to come in to close in the gap. They also similarly provided us what I would call, they called it the point of care equipment, which were meant to be used in the laboratories.
Kuje has so many hard-to-reach communities. I'm sure we have the highest number of hard-to-reach communities, and so of course, so we really benefited from the SOML funds to reach out to these communities that would have been difficult for us to take services to.
For the issue of Maternal and Child Health Week in the FCT, it's been glorious for both the implementers and the benefiting communities spread across the entire FCT. The long list of the impact achieved by the FCT SOML under this pillar is manifested below.
Was equipping of basic labor room equipment and improving on the other equipment in the antenatal care clinics. Then let me quickly dive into Area 2 Primary Health Care Center that has been there for years. Do you know they were only doing immunization there? People would rather go to Wuse Hospital, Maitama, Asokoro facility for vaccination. The SOML gave that facility, and if you go there now, we not only give vaccination, but we also give quality, skilled bed attendant and delivery.
At Asiviti Town Clinic, Wawalada, Etipeni Nivi Mount. Shitile shiga shima ataga na mavi emeki ya ufu miyaje ala shiga shitilo shima eski ajimte biye ma bitilele meki na kagata na mo gume gembi fugo onamba sosai na mamutu tola shitinju kukari tile shigini biga omahu.
Family planning forms part of the pillars, and the indicator for this pillar is the utilization of modern contraceptive method by women aged 15 to 49 who are married or in a union. However, its performance in 2018 dropped to 22.3% from 2015 figure of 24.3%. To address this, several activities under family planning were sponsored by SOML PforR. Nutrition is also one of the priority pillars. The indicator for this pillar is hinged on vitamin A.
Saving 1 million lives supported was really helpful in the nutrition activities for under 5 children and women of childbearing age in the FCT, and it also really helped in reducing the malnutrition cases in the FCT, and also help in improving maternal health and reducing child mobility in the FCT.
The program, since inception in 2017, has consistently supported the implementation of the biannual maternal, newborn and child health weeks, which was hitherto a challenge due to paucity of funds and absence of support from development partners in FCT. The following are major areas of support during the MNCH weeks. Credit must also be given on efforts made so far on the pillar of elimination of mother-to-child transmission of HIV and AIDS. The pointer here is the proportion of women that had live birth, attended antenatal care, were counseled, had HIV test and received results. FCT's record was indeed encouraging, going by the figure of 36.7% in 2015 to 81.7% in 2018. This is attributed to the collaborative implementation between SOML PforR and the FCT Department of Public Health, improving the quality of care for mothers who are positive. The intervention of SOML in FCT for malaria control can also not go unmentioned. The index for this pillar is the utilization of nets, especially children under 5 that sleep on the long-lasting insecticide-treated nets. The Center of Unity improved the performance figure from 16.5 points in 2017 to 36 in 2018. The synergy again was handy, improving the FCT malaria story, which was achieved through a sustained campaign.
We have reached the community in the 62 political ward in the 6 area council in the FCT. We have 62 political ward. We have directed distribution and utilization messages to all the 62 political ward, and we have reach our target. We have even extended it to pregnant women in our facilities across health facility in both public and private facility in FCT.
The good story of SOML PforR in FCT continues with the provision of essential medicine, and the measured performance was scored high, owing to the implementation of planned activities that have brought about quality of care at the PHCs. This has also seen to the provision of essential medicines to over 152 facilities across the 6 area councils. This is in addition to providing medicine cupboards. Apart from the gains made in the core pillars of this program that is centered around the PHCs, the FCT SOML PforR also supported secondary health care facilities through some donations to help improve health care delivery services.
Soko District Hospital has received critical care medical equipment for managing sick patients, and this was supplied by Saving 1 Million Lives project. We have various equipment that were supplied, and I'll be mentioning them. We have multi-parameter patient monitors, which has contributed in being able to monitor and triage patients. We received 7. And the infant resuscitator with warmer. This is situated in the theater, and it has helped to reduce newborn morbidity and mortality in the hospital and in FCT at large. The anesthetic machine with vaporizer, we have 1 received at the main theater, and the main theater does specialized surgeries. We have surgeries for orthopedic surgeries, general surgeries, and even the anesthetic unit utilizes this machine.
I wish to also thank SOML for at least considering Yaya General Hospital to benefit from this package. We have benefited from the electronic medical record system, which has been supported by solar, and this has made it possible for us to be able to offer patients prompt services.
We've seen so many impacts in healthcare system in Kwali General Hospital, because we received some items from the organization that help us to manage our patients effectively.
Some of the services that have also put the FCT top amongst equals are its social mobilization, where every stakeholder was important, and aggressive awareness given priority through jingles, street shows, advocacy visits to religious, community and traditional rulers, as well as target groups and house mobilizers.
We have never had it so good in social mobilization. SOML projects have allowed us to touch so many areas in our work, especially social mobilization, sensitization, community education. We have gone to interior in this FCT in educating the populace about their health.
Right away, we are having outreaching in some of the community like nomadic settlement and some hard to reach community in FCT using what we earn from Save 1 Million Life, using our long-lasting exercise in terms of advocacy during outreaches, during advocacies to communities to access services in our facility.
What the organization of SOML has done to FCT entirely is a welcome idea and a welcome program. Because FCT administration, particularly the health department, primary care department, has achieved.
Other support provided by FCT SOML to the area councils include capacity building, repairs and provision of logistics, amongst others. As members and stakeholders of the FCT SOML count their blessings while taking stock of how beneficial and successful the SOML initiative has been in the FCT and indeed Nigeria. It is the hope of many that this life-changing initiative continues.
SOML have done a lot, I must confess, and we are very grateful to SOML. We would have wanted them to continue the good job. So we are still hoping that World Bank will assist us the more.
Area councils cannot do it all, and this has been something that has been impactful, really impactful, and we really appreciate it. We wish they are not going.
Although the program ended February 2021, FCT SOML PforR developed closeout work plans for the fund and got approval from the National Coordinating Office for being in line with the SOML PforR implementation guidelines. The plan was acknowledged by the Honorable Minister FCT and utilizing some of the funds to support cholera outbreak response.
The Saving 1 Million Lives was the first program perhaps I came in contact with, because there was an intervention on the cholera outbreak in various communities in the FCT, and I have seen the tremendous contribution this particular program has done to curtail both mobility and mortality.
In the FCT, I think we've done very well. When you look at the targeted outcomes in terms of number of children saved and the number of women that have been saved through specific service delivery.
The results are there for people to see, and unfortunately, it's just only few areas, and that's why it's difficult to see so much. But if you go around the PSCs where the interventions were done, the results were there. The maternal mortality has reduced in those areas.
The following illustrates FCT Saving 1 Million Lives program for results achievements in the year 2021. for all key players in the FCT SOML PforR, it's been worth the while, working as a team with high sense of commitment, patience and sacrifice.